Hi there, welcome to Healing After Infant Loss. My name is Rosie, and in today's video we're talking to Yari, who is a licensed mental health counsellor in the state of Florida, and in today's video we're talking about PTSD after infant loss. I have a list here. Some of the topics that we talk about are: what is PTSD? Is it possible to experience PTSD after infant loss? How do we diagnose PTSD? What are some examples of PTSD and symptoms of PTSD? Is PTSD something that lasts forever? And what is post-traumatic growth? We also talk about how to address symptoms of PTSD and process the situation. She also talks to me about acute stress, baby blues, depression, prolonged grief, traumatic grief, and other types of trauma such as secondary trauma. We also talk about, does PTSD come with depression and anxiety? And then finally she gives us some advice for people with PTSD. So I really hope you enjoy this video. Hi Yari, welcome to Healing After Infant Loss. Thank you so much for being here. Would you like to introduce yourself and talk about what you do?
Hi Rosie, and thank you for having me again. So yes, I'm a licensed mental health counselor in private practice. I've been in private practice since 2018, and usually I've been servicing supportive individuals in their day-to-day life stressors, life changes, as well as medical or mental health challenges like anxiety, depression, relationship stuff, family stuff. And prior to that, I was working with different forensic populations, sex offenders, the homeless, substance use, perpetrators of domestic violence, and also had the blessing of working with families, first-time parents. I was a family coach for a couple of years. So this is a little bit of me.
Perfect, thank you so much. So today I would like to talk about PTSD and infant loss. So could you start off by telling us a little bit about what PTSD actually is?
Okay, so PTSD is post-traumatic stress disorder. And what usually causes it is having experienced a series of events or just one event where your life was at risk, in danger, or where you almost died, or inadvertently witnessed something along with those lines for somebody else. So the difference between PTSD and other diagnoses around trauma is that it involves danger and life-threatening situations.
Okay. So I think when people hear about PTSD, we often think it might be war veterans or people that have super dangerous jobs, which kind of makes sense with what you've said. But is it possible that people who experience infant loss, in whichever way it might be, could also experience PTSD?
Yes, because depending on how that loss came to happen, the mother's life could have been in danger. And if her life was not in danger, but it was the baby's life or the infant's life that was in danger, and you were worried for that child's life, then it's secondary trauma, right? You're not the one in danger, they're the ones in danger, and there's a life-death risk. So yes.
And how do we diagnose people with PTSD? Because I only read about PTSD maybe in the past 6 months or so, and I thought, holy shit, I probably had PTSD after my abortion, because like we would go to therapy and it was at the same hospital, on the same floor, on the same ward as where I had the abortion. So every time we went back there, I was just in bits. Anytime I saw babies or heard babies crying, I was in bits. I remember I physically wanted to stab pregnant people, and that is awful to say. I obviously don't recommend it, but I was just so angry at everyone. But there were certain things where like I kind of looked at the definition of PTSD and I thought, okay, I probably had that for a while. Like, how do you diagnose it? And then also, is it something that can go away, or is it stuck with you for life?
PTSD is just one out of different types of trauma expressions. So PTSD is diagnosed depending on a series of symptoms. Some of the symptoms include having been at risk of life-death situation, whether again it was you directly or you were in a situation that involved that for yourself or for somebody else. So school shootings, for instance, PTSD. Car accident where I was walking and after I just crossed the street, a car came and tumbled over somebody that was right behind me. PTSD, because I witnessed something that somebody's life was at risk and in danger. Infant loss, again, PTSD, because there's a life at risk. There's life-death experiences. So that is usually the first symptom that is looked into. Then you have nightmares, flashbacks, or intrusive thoughts about the experience. And within that, you also want to avoid them, right? So you don't speak about them, you don't want to acknowledge them, you don't want to validate that they're happening. You want to do everything in your power to avoid anything related to that. So if I used to go to the hospital where I had the miscarriage or the abortion or the loss, I don't want to go to the hospital because it's going to be triggering for me. I want to avoid any type of association related to that trauma. I'm going to also experience hyper-alertness, where any little sound might trigger me, activate me in a way where I get fearful and I'm on the suspense. I'm in survival mode. I feel that something might still be able to happen to me even though I've passed the event. And not all symptoms need to be present for a diagnosis. You need a minimum of symptoms. So that's where an assessment is usually necessary.
Okay, and then is it something that people can move on from, or is it like you've got PTSD, therefore you have it for life, or how long does it usually last, or is that kind of, you can't really say because it depends on the person?
So it does depend on the person. I cannot stress enough the power of processing and belief system, right? There is something called post-traumatic growth. And post-traumatic growth has to do with how the individual that has experienced the traumatic experience is going to take a look at their life and say, okay, now because of this, I am wanting this, so I'm going to go ahead and do this. So that is a post-traumatic growth where you integrate the areas in your life where you want to pursue something else, something that is more meaningful to you, and that you maybe are going to be in service of others by sharing your story, by showing support to others that before you wouldn't relate to or understand, and now you do, and you want to have those conversations instead of avoiding the conversations. So this is where personal processing comes into play.
And then how can people heal from PTSD? So obviously we've talked about the shaking, we've talked about yoga and therapy and like talking to professionals. Is there anything that works specifically well with PTSD, or is it again just depends on the person and what's going to work for them?
So in the clinical world, there are a couple of techniques or modalities that address symptoms of PTSD, and keyword, you're addressing the symptoms to eventually process the situation. So a lot of people are not willing to process the situation. They're just wanting to address the symptoms. People that are just wanting to address the symptoms might experience PTSD longer or forever than those individuals that, besides the symptoms, eventually want to also address the experience. So when you address the experience, there's the possibility of expanding the view of what happened, what you felt, what are your tools, what are your coping skills, how can you actually manage whatever it is that you're feeling, thinking, experiencing to get you to that post-traumatic growth. PTSD, like I said, is one of different types of expressions when you have experienced an overwhelming emotion, and in this case, infant loss, right? You have acute stress. Acute stress is something happened. It was extremely stressful in your life, and for a period of about 6 months, you're going to be shaken by it. You might not know how to respond. In postpartum, they talk about the baby blues. It's not depression, it's the baby blues. So baby blues is a period where the mother is going to be sensitive and maybe crying easily at different things and just not understanding why, just she has a lot going on, the baby blues. That could develop into depression depending on support and what other factors are at play when that mother gets to go home with baby or not. And then you have psychosis within the postpartum world, which is when the mother experiences symptoms of psychosis that extend beyond the 2 other prior situations. So there's always possibilities of different expressions depending on what's going on in the individual. But usually an acute stress response is quite normal. It's going to last about 6 months. And then eventually you are able to reassess what you want to do and how you want to go about it. Then you have prolonged grief. Prolonged grief has to do with you're in a constant of grief for longer periods of time than the average person. and there could be indications of a possible depression. So prolonged grief is that overwhelming sensation of anxiety, depression, withdrawal, stress, grief, pain, anger, and you're going through that for a longer period of time. We have PTSD, which we have covered. We have traumatic grief. Traumatic grief goes even longer than prolonged grief because there was something, whether medical or legal, related to the situation. Maybe there was something unexpected that happened to you at the hospital, or maybe there was a lot of bleeding and there was a health condition that resulted from that. So there's traumatic grief, right? Because the experience came with added trauma to the already traumatic experience of loss. Then you have other types of stress and trauma related to future and how I envision a future, to medical relationships, to social support and cultural experiences, my relationship with my partner, financial concerns that might have aroused because of all the situations that we went through. And there's secondary trauma where maybe I did not experience it, or if I already did experience it, I come across a mother that now is going through it, and now I'm added on that emotion because I get to remember and re-experience through that secondary story.
Does PTSD always come with depression and anxiety, or are they like three separate things that can be individual?
It doesn't necessarily come with depression. PTSD can be a form of anxiety. It's a matter of who you speak to and what they believe. From my perspective, anything fear related has an anxiety component, because anxiety stems from fear, right? So any anxiety challenge is due to fear.
Is there anything else you would like to add about PTSD and infant loss that we haven't discussed?
Well, the only reminder that I think is important, if everything else fails, is to be kind to yourself. To be kind to yourself, to offer yourself some grace. If you've never experienced it, you're not going to know what's going to come your way until you're there. And just be graceful with yourself, gracious. If you have experienced it and you're still not understanding why, be gracious with yourself. You're still not understanding why, and validate that all of that comes with it is important to you. Nevertheless, you are able to take the time to be with you in a kind way.
Thank you so much. Thank you for recording this video about PTSD and infant loss. I will of course leave all your information in the description box so people can find you, but thank you so much for sharing your wisdom with us.
You're very welcome.
So I really hope you enjoyed that conversation with Yari. The book of the week is The Complex PTSD Workbook, A Mind-Body Approach to Regaining Emotional Control and Becoming Whole by Ariel Schwartz. This workbook offers practical exercises for understanding and healing from complex PTSD, which can help individuals process trauma, manage triggers, and begin the journey toward recovery. So I will leave that book linked down below if you want to read this book. I'll also leave other books as well. There's a page on my website with lots of different books with lots of different categories. You can have a look on there if you want to read any of the books. But of course, this one will be linked on Amazon. And the affirmation for the week is, I am safe and I have the strength to heal from my past traumas. I hope you enjoyed this video. Thank you so much for watching, and I'll see you in the next one. Bye.